Opening Keynote by Dr. Khulood Mohamed Alsayegh.
What do you see? A cappuccino? Has everyone had their coffee this morning? This is just a cappuccino. It's a cup of coffee, nothing special. But once you have that sip of coffee with a friend or with few colleagues in a place that is quite inspiring, this changes from a cup of coffee into becoming an experience. And if you think about it, this is the experience that we need when we implement technology and AI. We want people to enjoy that experience, to come back to it, to want to have it again, that concierge service that we're looking for, that personalized care. And up until, let's say, a year ago, this was the message I was giving when it comes to technology. I was like, it's enhancing patients' experience into a different level, that they want to start using it a bit more. But as time comes by, I realize digital health is very complicated. In fact, a third of the data is actually to do with healthcare, and our expectations of that is quite high. We think that if we put AI in everything, we're going to enhance experience and we're going to make things very simple. But in fact, it can complicate things. There's a reason why in airline industry things work together, because somehow they talk to each other. You go online, you book a ticket, you receive the ticket, you travel, you know what to expect, and you reach your destination. This is not the case in healthcare. It can get very complicated because there are a lot of complexities with data. We spoke earlier on with Alex in the reception about who owns the data, and I feel the complexity arises from there. I mean, breaching of AI, if the data gets out, if we are over-regulating the data, if we are under-regulating the data. So it's very important to think on all aspects when it comes to healthcare, which complicates things. I'm not saying it's impossible, but they're a lot more complex than other industries. And integration of the data is one of the only tools that we have done so far to bring data together, to have more accessibility, to have more control on the data, which I feel is very important. And we have to ensure that there are AI ethical considerations when it comes to the data. So, for example, not just ownership, but human insight, privacy of the data, security measures, transparency of the data. So there are a lot of components. I can speak all day about AI ethics, which is very important to consider. Another important thing when it comes to any technology in healthcare, so it's just not about enhancing patient experience, but about giving that purpose for the patient. Does it make sense for the patient? Is it something I'm going to start using, or is it just some jumbo-mumbo bells and whistles that makes no sense? Are we talking about an evidence-based practice, something that would add value to the patient? Is something that we're looking for in any technology that comes down the line. Dubai Digital Strategy is starting off this year. We're working on it for a period of 2 years. We have to ensure that this strategy is aligned with Dubai Healthcare and with Mohab strategy and with other international strategies. And the reason why I want to highlight the light on Dubai Digital Strategy is it opens doors for prospects in the future because there is budget, and it's something that is a core implementation for the UAE. So we're always open to ideas to see how we can enhance patient experience, how we can provide a purpose for the patient, how we can use AI to provide evidence-based practices that can increase patients' value and outcomes. So an overview of what our expectations are with Dubai Health Strategy is, in digital health, is to have that personalized care for the patients, something that is tailored enough to fit the patient's requirements, something that says, yeah, that's me all over it, this is going to work for me. Also to have that participative approach in which we include our patients in the process. The old scenario where having the patient in the center and everything works around it, I don't believe in that. The patient is an actual arm in the process of developing any technology, any process, any strategy, any technology that involves patients. He has to be part of it because he does have a say, what works for him, what not. During the pandemic, we came up with the telehealth platform in the government sector. Patients were not using it because it didn't make sense for them. We had to involve them and ask them what are the challenges, what's not working for it to actually being used. So if there are no patients, it's not going to work. We have to focus on preventive measures. Currently in the UAE, the preventive measure is about 4% and only 1% on rehabilitation. And we want to have that shift in technology where it will focus on prevention and self-care rather than focus on disease burden, which will cost a lot of money. And it doesn't make sense with technology because it's quite limited. And the last thing is population base. I mean, there are amazing technologies out there, amazing areas, but it has to be made tailored and has to be working to fit the UAE culture. So it might do brilliant jobs somewhere outside, maybe in the US, but it has to fit our requirements in the UAE for it to make sense. So ideally, we would like to have that digitalized patient journey. And when I say the patient journey is the patient be able to monitor himself, be able to self-monitor, immediate access to any diagnostics, telehealth, and have a home healthcare access, and the whole thing in a device or an app. If he can have everything, we're digitalizing the whole journey. And this would be the perfect scenario because he will have some control over his self-care, and we are empowering our patients this way. But if we look into how things are in the UAE, it's not moving. Okay. This is the same thing as the patient journey. The icons in red is where it's very well established in the UAE. So basically, we're able to book appointments easily. We're able to find a doctor online, and we're able to have a teleconsultation and to some extent get a prescription done. But the areas are in yellow are still in development. This includes integrating insurance into the process and having that aftercare, home health care that is needed, and then the follow-up process. Once the patient is discharged from the consultation, no follow-up is done through digitalization, and this is where we're lacking. So these areas still needs a bit of improvement, and that's what we're looking for. The service delivery, I mean, I'm sorry about the picture, but the patient is in the middle here. It has to be overall side, but when we come to patient delivery system, we have to make sure that it's meaningful for the patient and it serves a purpose for the patient. It has to be based on evidence practices and provide that holistic care. So as I said earlier, when we enter the telehealth consultation and the consultation is done, the job is not over yet. The patient needs to be seen afterwards, and what's happening after that, the aftercare, the home health care is very important for the patient and to serve his interest and focus on the preventive measures of the patient. I also want to emphasize on the transparency, which is one of the AI ethics when it comes to healthcare. And not only in AI, but in any patient care services, there has to be some transparency. The patient should be aware of the whole process. The patient should be aware if he's talking to an AI component. The physicians have to talk to each other. The regulation have to talk to public health sectors, the healthcare providers and payers. Everybody has to be transparent to know what's going on around them and to serve that patient's interest. Because if there is transparency in the data, we're able to analyze this variation. And when we're able to analyze the variation, we're able to identify best practices, therefore improving patients' value and changing behavior. So if we do have something great happening in the UAE, we would like to share that information and see how we're doing in comparison to others so that we can improve the outcomes. And with that exercise of that vicious circles and having that feedback and learning, we're also encouraging innovation. If it's always a status behavior, there is no innovation in there, but this would encourage innovation because we want to learn from each other, we want to continue that circle of learning and feedback and improving for patients' value and improving in innovation. Even as healthcare providers, we also have that change in our roles. So being a doctor or a healthcare provider has now changed to becoming a tele-doctor. And I feel like one day that phrase tele will no longer be existent because it's just going to be a doctor who does it through telehealth. But with the component of AI, that shift is also moving into a quality of life advisor. And a quality of life means somebody who can oversight the data, oversight the technology. If we trust AI 100% and make it do the decisions, we're moving into a revolution in healthcare. And we want to ensure that there is always that human oversight to hold accountable for any changes that are happening. At the end of the day, we are feeding the data to the technology. We should be able to read it. We should be able to understand it. We should be able to explain it. And we should be able to come up with outcomes that we can explain to our patients as well. And of course, this whole process would require our doctors, our physicians, our healthcare providers to be more aware of the technology, more trained with technology, and even involving them in residency programs so that they can understand what to expect and what to come. We want to focus more on incentives on values and not volume. And this is where insurance plays an important role to include that bundle care and moving away from fee of service. So as the example I said earlier, when you finish the consultation with the physician, it's very important to have that aftercare. An example that comes to my head right now is a woman, for example, who had a hysterectomy or a breast cancer, and she had a breast surgery. Her job is done when the surgery is done and the cancer is removed, but how is she feeling afterwards? What are the mental implications, the social implications for that, the cost? All of these important factors are not currently addressed, and it's important to have all of that covered and aligned with the insurance as well to give that holistic approach, that comprehensive care for our patients. And I would like to speak about the word equity. And equity of access doesn't mean accessibility to hospitals only. Through digitalization, I'm able to access healthcare everywhere, which is great. But we need to have that health outcome that is equal and equal in values as well. So it's not just access, it's equity in care, quality. Do we all get the same quality of care? That's very important to look into a bit more and makes us think differently as doctors because we're good at following guidelines. We follow guidelines, and that makes us a good doctor. But no, we also need to think how we can improve that patient's value. And that's what makes us different. And if we think in that way, things would change differently. And as my role in the regulation, I think it's very important to focus on all of the things that I've mentioned before. It's very important for us to regulate and give directions, because if we do that, if the regulations emphasize on that, we create that foundation of trust so that all facilities are able to adhere and think, yes, we are in alignment with the regulations. We also ensure that everybody is talking to each other. We have to ensure that the payment is linked to our regulations and guidelines, which we're working on at the moment. And we want to ensure that data is integrated and is being accessed by the right people. I want to touch a bit on leadership. I've recently added this slide to my presentations, and I think leadership comes from different aspects, not only regulatory aspect, but even leaders in the private sector, leaders in the public sectors, leaders and innovators and facilities. You have to have a strategic thinking which aligns with the strategies, obviously. But you also have to be a transformational leader, or you need a transformational leader to make that transformational and change. And most importantly, to add a systemic leadership. A systemic leadership is someone who talks to each other so that we can learn from each other as a system level and see how we can improve. The way forward with digital health strategy is basically what we explained earlier. Defining the governance, which we've been working on, digitalizing patient journey, digital health system, integration of health data, data analytics and AI for innovation, digital health research is very important, technology maturity, and AI ethical consideration. So these are the exact things we spoke about in summary. And just out of interest, maybe in a different conference, I can speak a bit more details. What are other areas that we're looking at in the UAE? We're focusing on health sustainability. We're focusing on mental health. It's a big thing, and it's for the next 2 years project. Genomics and longevity, preventive measures, hospitals without wall, getting outside the border, empowering patients so that patients will have access to their health system and taking care of themselves without going to hospitals. You don't have to be among walls to get the service you need. You can do it from the comfort of your home, and then focusing a lot on medical education and research. If you bring an innovation to the UAE, sometimes it's very important to have a pilot and get it tested in the UAE and have that evidence showing that it's actually working in Dubai. It brings it more appealing to enter the market. What do you think the future looks like? No comments? Okay, so it's like an immersive world somewhere floating in the space, some technologies around us, like somewhere robotic. And this is why we think this way, is because we are kind of pre-equipped to think like that. The way things are moving fast, we think it's going to be an AI-driven solution. But I'll tell you what, the future in my head is something like this. And I don't want to scare you, but what I think is, it's quite vague. I don't know what's happening there. Maybe there's a tree, maybe there is something at the back, and I can see something here. It's not very clear of what I expect the future to be like, and this is the real thing, because there are areas in the future that we think we know. There are areas in the future we know we don't know. There are areas that we think we know that we don't know, and there are areas that we don't even know that we don't know. And all of this is based on biases. I'm going to conclude my presentation with my recent trip to Portugal last October. And this is Pina Palace. It's one of the beautiful destinations in Portugal. And this is the exact same palace from different angles, red, yellow, and gray. And the reason why I showed this picture is not just to entertain and maybe encourage you to visit the beautiful country, but when you look at it from a different angle, you add a different perspective to it. Sometimes you need to see it from different angles to get the whole picture of what you're expecting. Today, I've added my perception to what digital health is in future as a regulator. I would like to hear your perspectives as investors, as healthcare providers, as startups, as innovators. What would be, so we can have a complete picture and eliminate those biases. Thank you so much. I'm not sure if I should be waiting for questions, or you can catch me towards the end. There's time for questions, or? Okay, please. I think we need a mic. I can't hear him.
Thank you for a very interesting presentation, and great to hear that you are leading the wave. So with regards to the emerging technologies, especially the AI, this comes with a lot of privacy and a lot of those challenges. And in a lot of countries, they have their own, of course, data privacy laws and everything. So how you are dealing with the privacy part in implementing AI, and especially with regards to the biases within AI in UAE context?
Thank you for your question. At the moment, when it comes to regulation, we assess platforms and look at the component of privacy as a minimum requirement. But I've actually recently been certified as an AI ethical assessor from the IEEE, and actually I'm the first one in the region to become, humbly speaking. And thinking that I'm the first doesn't only make me feel like, wow, it's a great thing. No, but it makes me think we're lacking that. We need more people to be involved in AI ethics and understand these complexities and those challenges that may arise from AI ethics. So I've collaborated with Mohamed Barash's School of Governance, and we're starting batches of training people for AI ethics starting from April, to increase that awareness of the importance of AI ethics, so that when you come up with an innovation, you understand the implications. The other thing I'm doing is, with a digital strategy, we're implementing AI ethical considerations in our platform. So there are going to be minimum requirements that we need to exclude those biases, to see how it's going to work. We're going to look into different components of AI ethics, which is like transparency is a very important one for me to understand the whole process, and it's very transparent. It's unlikely to develop any biases. Those requirements would be set as a minimum requirements at the moment, but we're going to build on it slowly. So when we get any innovation, any AI component in an app or a technology, we will have to assess it internally into those components to ensure that we eliminate any biases. Thank you.
Continuation to that question, see, the biggest challenge GCC today is the cloud hosting, am I right? Is there any changes on the regulation of unified GCC cloud? Because there are a lot of AI applications, and the biggest challenge is the economic of scale to implement this cloud in every country and to host the application?
I totally agree with you. As much as my scope allows, I'm able to support the regulation in the UAE. But down the line, this AI technology needs to be regulated at a worldwide level, where it's not sufficient for us to work only from the UAE. So what we're going to do is down the line, I feel there has to be some collaboration, at least within a GCC level, and then moving down to include other countries so that it can be regulated at a higher scale. I wish I can give more details to that answer, but I totally agree and support what you're saying. For us to collaborate with other countries, we have to understand each other's legislations, and sometimes we take technologies from abroad that we're working in our everyday lives and we're not able to control it. So it's very important to at least start controlling it internally and see how we can expand that and involve everybody in it.